Thank you guys for joining us on a Tuesday. We're going to roll through digital scanners, some comparisons of scanners, how I've integrated them into my office and how you guys can do that in yours, and then just info on the nuts and bolts of ROI on using these things in your practice. So who am I? I'm Casey. I was born and raised right out of Tampa. Went to dental school at Nova, did my residency down at UF Naples. I do currently own an office in Apollo Beach, Florida, which is a little outside of Tampa as well, and run a tongue tie center out of there. And about almost 2 years ago, coming up on it in the summer, integrated using the digital scanner in the office. And that's what I'll kind of speak to you on. The objectives for tonight, we really just want to understand some of the benefits in general of using digital scanning as opposed to a traditional impression technique. We'll go through some of the clinical applications, what I use it for in my office, bread and butter wise every day. We'll go over just some scanning techniques, how to integrate it into the practice, how to get your assistants used to doing it, utilizing it in an efficient manner so you can be productive throughout the day, and then just how you integrate it day to day. It does make your day to day flow a lot smoother, makes appointment times more predictable, which is always nice if you're running a busy pediatric practice like most of you are. And then obviously as a business owner, making that decision, you need to make sure it's going to be financially not only feasible, but beneficial for the office. So we'll talk about some of that at the end. And feel free to ask questions in the Q&A, as Aaron said. We will also give our information at the end of the lecture. So if you forget something or after the fact come up with a question, you can email myself directly or one of the New Smile team members and they'll help you out. So why am I here? Well, I got this back in June of 2023 and New Smile team had approached me. I've known them for a while and asked if it's something I would speak on just because I've been happy with the product. I did do a lot of looking into different scanners and kind of how I can utilize technology to make my life easier, make some of my patients' appointments easier. So I jumped on board a couple summers ago. We have not taken a traditional impression for an appliance or space maintainer or any other intraoral device in the office since then. We've been able to use the scanner really easily. And my team has come to love it. And our team or patients really like it too. It just makes the appointments fast for them. Integrating into the office and getting into your day-to-day, we all have systems. It is an easy transition. We'll go over some of those like tips of how to integrate it. And then as a personal kind of preference, I tried to stay ahead of kind of the curve on technology. I'm a millennial. I'm not super tech savvy, but the tech today does make it a little easier to jump in, even with little to no knowledge on it. So not a real strict learning curve on it. So the major reason I wanted to switch is because I did not like impression visits on adolescents who were orally averse and or just didn't want a big PVS or alginate impression in their mouth. Those were always not my favorite appointments because I'm seating the impression. Sometimes you're taking multiple impressions and not getting the anatomy that you really want for whatever you're making appliance-wise. So for me, it was like, if I can get something for a decent cost and it's effective and it does a good job, I'm going to switch. So that was my main want. Now, from an obvious kind of day-to-day practice, I wanted to make it more efficient for the office. I want my assistant's job to be easier. So getting them to do those impressions is a lot smoother. It's more predictable on the timing of the appointments too, because we know even on a tougher kid, as long as they'll open, we're going to be able to get an impression. There's not a lot of kind of stimulation intraorally with it. That's too averse for a lot of kids. Learning is the learning curve. Like your young assistants are going to get it really quick. Your older assistants, they're still going to get it quickly. It just depends on how many kind of rotations they do. For me, it was no more kind of actual material in the office. We do keep some alginate and some other stuff in the office in case I need a physical impression, but I don't have to stock that on the monthly and keep inventory on it. And then the parents really are impressed with it. It's not crazy technology. A lot of their general dentists probably have scanners, but when they see a pediatric dentist utilizing it in different ways, they do appreciate that and they tell their friends about it. So that's a way to market your practice as well. The accuracy is awesome. Even with, taking a good impression on a still kid who was doing good, I'd still get some space maintainers back that I had to adjust or modify. These, if you don't have a kid delay coming back, for months and there's no space loss, they're going to fit like a charm every time. So that's just more predictable for our day-to-day flow. Instead of booking a 30-minute appointment for delivery, I can just pop them in a room for 15 minutes because I know it's going to be a really simple process. I also wanted to make sure that we could integrate it easily in the office. I use Open Dental, so I can do a lot of third-party integration, and this is really easily compatible with a lot of techs that have open architecture like it. And then the indirect banding was something I did not foresee utilizing because I was just thinking it was to make my job easier. But the actual banding techniques that NeoLab uses, and there's any lab that takes an STL file can be used with the scanner. I utilize them because they do have like a little integration with it. It makes your life really smooth. And we'll talk about some of those benefits on some tough kids when we get into the clinical side. So the main reason I chose the Allied Star, I wanted something that was small enough and made for pediatrics. So this does have a pediatric tip that is smaller than your traditional scanners that your general dentist colleagues will use. And that's big. We work in small spots. Those big scanners can't fit in every mouth. And this does give you the ability to get into like even like a 2 or 3 year old's mouth really easily and get some good anatomy if you need it. The tech behind it, like which laptop to get, this made it very simple because it came with everything already loaded on the laptop. So I didn't have to have discussions with IT outside of this. Did I get the right computer? Does it have the right processing? And then I'm a big cordless guy. If I can utilize something without having an extra cord or hose in the office, that was a big benefit of it too. I'm also a stickler for like recurring costs. If I buy a product and I spend a lot of money on it, I don't want to continue to pay for that product monthly because I already made my initial investment. And that was a huge benefit. And then in reality, all those kind of come down to what do you want? And then what's the cost overall? And when I was looking at costs, this was still one of the most beneficial for what I needed, but also cost effective. They do make 2 different scanners. They're essentially the same tech in the scanner. It's just one has a cord and it's a little bit lighter. And then the AS200E, which I have, is the cordless option. And it's a little bit heavier, but I've never really had any issues holding it. And even my petite assistants never have issues holding it. And our ortho assistants that come in now, they actually prefer using this over their like iTero they have at their other office. So it is kind of just an easy to use device. But as a business owner, you're going to look at all this stuff. And when you're taking into consideration your monthly, not having any subscriptions to pay, and then having a lower starter cost with everything all loaded on a laptop, just makes your job simpler. So the basics of it, like your traditional workflow in the office is going to switch right away. Instead of having, sometimes a quick alginate impression, sometimes a really long alginate impression appointment, depending on the numbers of takes and gags and potential throw ups, your scan's going to be very quick. I can do a decently fast impression on the scanner. My team, they do them all the time. They are way quicker than me. So even in a sedation case, I'll pop up and be like, hey, I'd rather leave this kid under for less time. How about you get in here and do this scan while I'm kind of getting things ready on the side for something else? So I let them get in and they're in and out in just a couple minutes. Lab work is non-existent because everything's digital. You're sending it just directly to the lab. There's no back and forth from the lab other than the ship to you. So you don't have to get it out in your mail or have somebody drop it off. It's automatically there. So you're going to save some time there from the non-snail mail side of things. And then also the kind of file to get there is so quick they can get started on it right away. And then they're going to get it back to you quick as well. And what we'll do is we'll kind of compile a number of cases, sometimes over 2 to 3 days. And we'll say, hey, just save all these for this one day. And we'll make sure we schedule all our follow-up deliveries at the timely manner so we know it's going to hit at the same time. Just utilizing your different workflow, your different shipping costs, and your actual material needs, you're going to pay for the scanner in 2 years. Just from the basic, I take impressions for Band and Loops and Nances and lower linguals. You're going to save money over 2 years with nothing else included. So what we'll do is kind of first walk through like kind of how to set it up. Aaron's going to roll you through this guy. When I first got mine, I didn't have webinars to watch. I totally could have called Jordan or Aaron or anybody and said, "Hey, I want to do this together. Let's walk through this. What should I do, or how do I get started? What do I watch?" I just plugged it in and started playing with it, and it really is that easy. I was able to kind of get it up and going and start scanning after I learned what to plug what into, and that was like a quick 10-second kind of troubleshoot. And starting the scanning is pretty simple with your team. Our team, we just said, "Hey, we got a scanner, over lunch, play with it." And then I did a little demo for them. So I kind of give them some tips, and then let them roll through that. And then they would work on each other during lunch sometimes for the first couple of days. Before work, we had a little session so everybody could kind of make sure we were standardized in how we'd approach it. And then they were running. So it was like a kind of a 2-day get the ball rolling. And ever since they've been using it, obviously you get more and more comfortable. Just like any dental appointment, you're going to adjust your position to make sure you have good visualization and kind of good angle in the mouth. And then the reorientation on the scanner is really simple. I remember in dental school, I would always have trouble kind of picking up where I missed the scan and orienting. This one, you just kind of roll it back to somewhere you were and it picks it right back up with a red to green box. And you'll see that on some of the examples. But we'll kind of go through a lot of those as we go through the presentation. So I'll hit this for you, Aaron. And do you want to, is he talking in this or is it you talking? Let's
see.
I think he might just talk. So you might be
okay. This is Jordan. He's not with us tonight, but this is Jordan.
This is Jordan. He's one of your new Smile reps as well. He's good.
Action. So today we're going to be going over how to set up your scanner and going through a full scan. So first thing you want to do is take it out of the box here. We're doing the wired scanner today, this AS260. You want to be sure to grab your power cord. We're going to get this all plugged in. So you're going to take your USB, plug it into your laptop here. Now we'll get our scanner set up. Now you're going to want to take off your protective cap and you want to use one of your scanner tips. This one is Aaron's. So go ahead and pop this on. Take your little holder.
And that's the adult size one. So the pediatric one's even a little bit smaller than that.
Now what you want to do is you're going to want to open up your software. We're going to use AS Connect right here. So we're going to open that up.
And this is all preloaded on the laptop if you get it.
To go into our cases. Here, we're going to want to select new case. So we'll be practicing on Aaron. And as soon as you make your case name, it's going to auto-populate generate. So up here on the top right, we don't need to worry about anything else at the moment. We're going to hit scan at the top right. Once we hit that, this is going to open up what's called Scan Pro. This is our scanning software. We take our scanner off the charging base here. You can see light is always on. That does not mean scanning. However, when I press this button at the top, it begins to scan. Press it again to stop it. No box enters. So today we're going to be scanning Aaron. Aaron, we're going to start with the lower. So all we got to do here, click the little M button. We can see the top of the laptop right up there on our lower icon. However, if you don't scan the proper upper or lower, you can always flip it in the software as well. So you don't have to worry too much about that. So we're gonna go ahead and scan. So what you wanna do is we want to start in the posterior on the occlusal surface. So we're gonna start back here. Go back to the occlusal surface. We're gonna work our way all the way around. Once we get to full posterior, we're going to start to work our way buccally. And then we're going to lower lingually. Here's the top of our scan. We're going to see what information we have here. So now at this point, these specs here, these green specs, are telling where we need to go back and hit. So we can see we have some interproximal spaces. mainly on the lingual side, and then here on the facial of the anterior of the lower incisors. So all we're going to do is going to go back in, we see our spots, and we're going to touch those. Why don't you open up for me, Aaron? So again, I remembered mainly on the lingual surface of the posterior. Make sure you get all those interproximal spaces. And then we're going to come up here to the anterior. I'm going to make sure we want to try and get that facial side. So that should be pretty good. And what we can see here, we filled in just about all the gaps there. We have a couple little smaller interproximal spaces, but we're perfectly good. So now we can see our 3D rendering here, really good scan. We don't need to cut anything out. Of course, if we were going to be doing sort of space maintain or anything else, we don't want to go touch up on those spaces again, just for the greens. But right now, just for records, we're good to go. So only difference would be, we're just going to do the lower today. If you wanted to, you would just click over into the upper, do the exact same thing on the upper, and then full bite. Once you have the upper and lower, scan both sides for your full bite. However, we're just going to do the lower today. And again, the main point is you want to start on the occlusal surface in the posterior, work your way all the way around, work buccally, lingually, and then that should be your whole scan. Now we're going to click up here when we're done with our scan on the refine tab. Telling us we have not captured the upper, it's fine. So once we hit refine, what this is doing is this is turning the scan from a raw format down to an STL format. So it's really, really condensing that scan. It's kind of talking to itself. And now we can see, boom, it's refined. And now at this point, we're finished. What we can go ahead and do is we can click finish up here at the top right. And then now we have our file. We are finished. We now have Aaron's lower jaw scanned in here, and we can do with it as we please. And that is your whole start to finish, setting up your scanner, getting a scan, finishing your case as quickly as that.
So that was kind of the full rundown. And the only difference between the one Jordan just used and the cordless version is where the USB port is on your computer. There's a little like kind of Bluetooth connector, looks like a USB kind of file keeper, and it just plugs right up and it connects Bluetooth to the actual scanner. So other than that, it's all the same. The software is preloaded on the laptop if you get the laptop with the scanner. And obviously, if you have your own laptop that you want to get the program put onto, you can. That's really how we got started. We just opened it up and started playing with it. You refine your technique as you go, but not a really tough setup. This is more of like a day-to-day what we do in my office. This is one of our patients. This is one of my assistants, and she's just getting upper lower scans and a bite registration, so we can do some aligner treatment on them. So we'll kind of roll through this. This is sped up a little bit. The kids think it's cool because it's like a little video game for them. So they want to interact with the computer. They want to be able to flip their model around and kind of see what's going on. It does get them more on board with any treatment if they're engaged. It's a good behavior management tool in that sense. And the visualization on it's really good. So if you're trying to like educate a parent or even a patient on kind of what's going on or where they're having an issue, this is almost better than an intraoral camera sometimes because you can see it from 3 dimensions. So we'll use it for that sometimes for patient education. We don't scan every single patient that comes in the office for records. You definitely can. Like if you want to have like kind of an archive and make it part of your intake, it could be a piece of your office and something you show off right away. And then you could utilize it for any treatment needs and or case presentations. But in pediatrics, obviously, we're doing more quick bread and butter. But in that time point, she got the upper lower scans and she kind of let the patient see between, got his buccal bites, and that quick, she has the scan ready to go. She'll refine it and kind of get it into the SCL. And then once it's there, we have software on the laptop that directly connects, and we'll kind of walk through what that looks like as well. This is another office that was just showing off how they trained their assistants, doing a little after or before hours training, and she'll talk a little bit.
Hey, Raquel. If it stops, you have to go back to an already scanned area to pick it back up.
Okay, got it.
Nice. Yeah, you're way better than me.
So you saw the little red box to green box. Green just means it's captured. Red means it's not. The little ticks, that tells you if you're on the right track or not. When it stops, it means you've kind of lost your scan position, and that's when you just kind of roll back to an area you scanned. I didn't know this for a while, but you can integrate music into the scan. So now we have like the Super Mario Bro or Mario's theme song going. So kids like that even more. It's just more interactive for them, and it's a little more fun than the clicks, but you can customize it and make it cool for your practice. But this is what we did to each other for a couple of days before and during lunch, just so we got acclimated. And it's something most of the team picks up really fast. Even my more non-happy with change older staff members are all on board after just using it for a few weeks. So after your scan, you get your anatomy you need. Obviously, if you're doing a space maintainer and I only need limited anatomy, you're not going to need to get a full anatomical view of the mouth, and you as the doctor get to decide that. What you send to the lab, you're going to send your prescription. I use NeoLab with the scanner. NeoLab is on the same laptop as well. You can use any lab you want. Any traditional lab nowadays will take an STL file, and your ability to kind of keep that fluid is there. I gave NeoLab a go because I liked how they 3D print some of their appliances as well, and some of their band options, which we'll talk about. And they gave me really good products back. The cost difference is there on some of the appliances, but the shipping one way and the efficiency in the office and being more productive outweighs the little increase in some of the prices for me. But this is kind of what your assistant will do while you're working in other rooms being productive. They got the scan. We have templates like this set up. So all of your traditional appliances, your mouth guards, anything you kind of make regularly or anything you make one-off, you can make a template for it and make sure it's good to go. So this kind of just walks you through what that looks like. So you open the little computer program. It's a website, and it'll bring you directly to this. You click your option of what template you want to use, and then you just start uploading your patient information. Most of this is pre-filled out if you have a template already. If not, there are drop downs and images that you can kind of hover over if you're looking at different appliance types. If you're looking at different band types and kind of how you want it to seat on the tooth, there's a little image option next to most of these that they'll roll over in a second, and you'll be able to kind of see, okay, that's what my band will look like. That's one of their 3D printed aluminum model bands are, and that's what I use a lot in my office just because it's clean, easy to use, and it bonds really well. Once it's done, you kind of get presented with the kind of finalization summary of what your prescription is, and then you're going to submit to lab. So this is what I look at. I'll make sure the scan looks good on the computer. I'll make sure that the script matches what I want, and I just click this into lab, and that's like me signing off on it. It's that quick and easy. So at the end of the day, if I have some, I can get through these in just a few minutes, as opposed to me having to write or kind of draw out anything. They make these for anything you want. So if you do a lot of habit breakers, any kind of thumb cribs, spikes, whatever you want, it's there. Traditional literally holding arch is obviously staple for your pediatric dentist, saving space back there. I do this in my Nances a lot with the 3D occlusal band. It stays super gingival, so a lot more hygienic, and for me, non-stimulating to the gums. A lot of these kids, they're higher risk. Hygiene might not be that great. We get a lot of gingival bleeding when we're seating bands subgingivally, and this makes for a much more comfortable insertion appointment. That's a huge benefit that I really didn't take into account because I didn't know I'd be utilizing these kind of cuspal coverage bands so often. But even on my very timid kids, my patients with special needs who are more sensory averse, I can explain to them that this is just going to touch their teeth, and when we try it, and it's just tooth stimulation and no kind of gingival irritation. So if you do have one of those TLC kids, or you have a 1930 with a heavy distal operculum, or the bone's a little too high on the distal that you can't seat that band completely, this is a perfect option to kind of work outside the box, but still get a really good space maintainer made that's going to last over time. And again, your Nance, you can obviously pick your acrylic color just like any other lab and fancy it up for your patients so they kind of get with the process a little more. This is something that NeoLab had, and I kind of put it in every kind of, cabinet so the assistants can open it up and kind of get a glance. This just gives them a quick and dirty, if you're making this appliance, let's scan this portion of the mouth. These are your traditionals. This is majority of what we as pediatric dentists are going to use. We really make a lot of appliances with this. We make a lot of mouth guards. I make some retainers every once in a while, and then some limited orthodontic stuff and aligner stuff, depending on the cases we do. We don't do a ton of ortho in the office, so it's mostly the traditionals, but it's there, and it allows you to kind of get comfortable with doing other things, because getting your impressions, making sure your appliances fit well are more precise. And for me, I'm willing to kind of explore new techniques, open new procedures due to it, just because it makes it easier. These are the band options that I was kind of talking about. We do use the 3D SLS a lot, and these are the supragingival, just cuspal coverages that don't go interproximally or subgingival. If you're comfortable fitting your bands yourself, you can still do that. That's what I did for my entire career until I started utilizing the scanner and 3D print option. But if you're comfortable in getting your bands fit, because you know they're going to fit where you want them, go for it. That's why I always did it. I wanted the lab to have at least the perfect position for that band on the tooth. With this, you do have to mail out those bands, so that's a little delay option. Now you can indirect it, where you can just take your scan without bands, and the lab will kind of fit them there for you. So if you still want that kind of full circumferential coverage that's going to go subgingivally, you can do it. And then the 3D SLS, this is their aluminum 3D printed kind of option. The intaglio of it is very micro etched, and it has a lot of porosity, so there's a lot of surface area for bonding. My biggest concern with this, especially putting it in a more TLC kid that needs a little more walk through the appointments, is debonds. Like, we all have kids get spacers out of their mouth. We just had Halloween. I'm sure a number of you were re-cementing crowns and space maintainers this week, but this stays put. I don't use band lock. I just use the Fujisim Ortho Blue, that has a little light cure component, and it makes cleanup easy, and the bond is really good. It's actually, I'm seeing a lot of these coming off now, just with when I started using them to, okay, we're ready to kind of take our space maintainer off, and the bond is strong on it. I was actually pretty impressed with how well it stayed on the intaglio there. This is just a breakdown, kind of like what we would traditionally do. If you're going to place, spacers or donuts, go for it, to kind of do your normal seating and getting everything done. With the 3D SLS kind of cuspal coverage that I utilize, there's no need for any spacers, any kind of donuts of any kind to spread things out. So the separators aren't necessary. You're still going to debond with your band remover, just like you normally would. So I did make a couple traditional band and loops, and I had one in the office. Now I utilize the kind of chairside kit from New Smile the majority of time, just because I like the universal application, and I kind of get a good band and loop done quick, especially in sedation cases. But this is kind of what it came back as, and fit like a glove. Super simple. And then on the model, you can kind of see how low profile it is. It's comfortable for the kid. And that's a really big one, especially on those like new sixes that just came in on that 6 to 7 year old that you're losing one of the E's on, and you need to get that space maintenance before you can really see the band. So I've been using it a long time. This is one of the first cases I did with it. This was a patient who came in with like irreversible pulpitis on T. She was very non-cooperative. We didn't want to try to Hail Mary anything on the tooth, so we decided, hey, we're going to get that out, but we need to utilize sedation. This was more of a, hey, I have sedation in a couple of days, we can get that done, and we wanted to get the tooth out due to discomfort, and I didn't have a space maintainer made for delivery that day. She was still transitioning anteriorly, 23, 26 weren't in, so I really didn't love the thought of putting a bilateral spacer in on a kiddo that didn't want me in the mouth too often to have to remove, reimpress, and then cement again. So I gave mom the option of, let me try to make something that doesn't touch her gums. So she's cool with me touching her teeth because she was always cool with the cleaning and me examining. She just didn't like us going and getting under the gums too much when we were doing work, and see if it sticks. I didn't love the way it looked. It did do the job. It's still in the mouth today, surprisingly. And we haven't had to transition her. And I told mom when it goes, if we need it, we'll throw a lower lingual on there. But this one made me a believer pretty quick on the bond strength of that. And she had that kind of distal operculum on the distal of 30 there. You can see that's a little raised. And that's what she didn't, I knew if I went in there with a traditional band, I was going to get a lot of pushback on that cementation date. But that worked out. Definitely not my traditional. And I thought I was very candid with mom that I didn't think it would work well, but it was worth a go. And it proved us both wrong. This is just another bread and butter dance, but I did use the kind of SLS 3D option on it. He was, I think, a patient with autism, and he was a tough kid, but he was, again, one of those, like, if I didn't overwork him and get into the gums, I could do a good job. And we got Jay out in sedation, and we were able to get this in after we fabricated it. We had to scan that day. My anesthesiologists also love this because we do open airway cases and deep sedation, so we have to protect the airway. And doing a full arch impression with alginate was always stressful for them, stressful for me, and not fun. Sometimes it was necessary in certain cases. With this, super easy. I can get in there with the pediatric head, even in a big mouth. I'm going to use that so I'm not stimulating the airway as much, and I can get all the anatomy I need. Just takes a little bit longer with a smaller head on a kind of grown kid, but it works really well. And this is just kind of what it looks like on the X-ray after you get it cemented. This was one of our patients. He came in kind of on an emergency basis. We met him that day. He was a nervous kid. He had an extraction to do. Tooth needed to come out. So we talked to mom, got it set up. We had him in the chair, non-nitrous. For 5 minutes, let him hang out. I went in and did SOAN to do some intraosseous on him, and this is directly after local anesthesia. We talked to mom and decided, hey, let's make a nance. We'll get the tooth out. We'll let it heal and get it cemented. Take care of you same day. So within, I think the entire op appointment was 20 minutes. And that was kind of me talking through a lot and kind of getting these videos done. Got the tooth numb, did our scan, got the tooth out, and he was on his way. The whole family comes to us now. This was our first time meeting him, but parents were impressed with the efficiency of the appointment. Having my assistant there helped because my associate there helped because we could spend a little more time doing this on an emergent basis. But it was quick same-day treatment and success. Obviously, you can see the heme that's on the scan there. I was not worried about that with the nance getting made. If it was something more precise, then obviously you can clean that up before you take the scan. But that's all you need for it. And we were ready to go. We got the tooth out, just a couple minutes later. And again, these are just those traditional cases, some lower E's that need to come out due to non-restorable, and the little distal operculum, little hot, and the kid doesn't want you in there. We do our normal kind of just get it done with the SLS for those kids. This is an add-on. I'll have Aaron kind of speak on this. This is also integrated in the software when you open it up. And if I can do this correctly, last time I did it without screwing it up. Aaron, can you see this?
Yes.
All right, so I'm going to blow that up.
Oh, there's your doppelganger, Nate Bergazzi. I saw him in this corner. All right, so this is the AI health report. So it's just kind of a cool feature that they have in there, and they keep making it better and better. Like when you have the laptop and you have all these programs that are preloaded in here, you'll get updates too. And so they're constantly updating these programs. And AI health report is one of those. So I think dentists use it clinically in all sorts of ways. Like if you had a really great treatment coordinator, they could use this to kind of, I don't want to say upsell, but upsell your client, and be like, oh, because it gives you like a whole list of, if you do the full scan, it'll give you a whole list of like ideas of things that can or should be done. So I think some dentists are using it, like they will print it out and give it to the parents. You can take out whatever you don't want the parents to see or kids to see, and you can keep in what you do want to see. I think some doctors are just using it like in-house, like almost just like a treatment plan or just some, like you were saying, like for every kid that comes in, just so you have it on their case or whatever. You can use it as like a before and after, if you're doing some restoratives or if you're doing some aligner trays or whatever, but it gives you shade options. It gives you, it tells you should brush your teeth more. I wouldn't say it's, a lot of people ask about caries detection when you're talking about scanners. You went to dental school. I would not use this as caries detection, but it is still good to like be able to show parents, like, when they're like, oh, why do they need an SSC crown on that back tooth? It's like, well, here, I can show you this bombed out tooth in the back, and it shows, without having to get mom's face in their mouth, as you can see, the picture is really good, and you can see caries, in the images. So how do you use the AI health report, Dr. Lynn?
I'd not use it for like a big treatment plan presentation. I'm more kind of just here, come over here and look. I have used the scans for parent education though, like especially when we're talking about space maintainers or kind of, okay, we need to take this tooth out, but this one, looks fixable, and we're taking a scan. I can show them like, hey, look at this. This is why we're doing this. And they understand the treatment more. They're more on board when they can kind of get involved. I haven't done any full reports, but if you do integrate more comprehensive work in your office and you're doing a restorative and ortho case in your office, which is totally doable, then this could be really good, especially if you're doing a bigger case on a teen kid, to help them out. Overall, it is a tool that comes with the software, and it's something you can play with. I've played with it a lot, and I do have some friends in the more general dentist world were like, hey man, I can have my treatment coordinator do this, like Aaron was alluding to, and they can just play with the AI, take the scan, take our intraoral photos, and really have something to present to the patient so they kind of know what they're getting into on the day-to-day. So after all the kind of how to use and what it looks like, as business owners, everybody wants to know, like, what's the ROI? Am I going to spend this money? Am I going to get use out of it? The tangible things that come just off the bat, you're not buying recurrent cost materials. There's not trays you have to get all the time. There's not alginate, PBS that you have to get all the time. So just not only money for that, but space in the office is freed up. You're not doing a lot of remix. The model is very, very accurate. You can do indirect dentistry with this. If you wanted to prep a tooth for a ceramic crown or a zirconia crown, you could do that. So, us making space maintainers and appliances, the fit's going to be really good. And when they're 3D printed, the fit is remarkable. Like I haven't had to bend a wire on one of those. The only one I had to bend a little bit was a kid that came in a little too late past his delivery date. They left town for a couple months. You're going to save on some lab fees in the long run because you're not doing a double ship. You're really just shipping one way, and you're not going to have those recurring remake fees where you have to go, this is the lab's fault, and they're going to go, no, that's an impression fault. You need to retake it. No pointing fingers. Obviously, good labs will take care of you, but some labs are stingy on that. The biggest thing for me was the chair time saved. Like, we can be more productive. I can walk in, kind of talk through what we're going to do. The assistants can do the scan, show me the scan real quick while I'm between rooms, and then dismiss the patient. And I can do the script, in 2 seconds down the road. So I can be more productive in another appointment. I can do a limited or an emergency appointment, or I can just do a recall, which is more productive than an impression appointment. So for me, that was the good business aspect. We can fill our appointments with different procedures in those time slots, as opposed to having to save 60 minutes for a really, TLC kid with maybe special needs that we have to go a lot slower with. We can chop that down to probably 30 and be fine. And, for your typical kiddo who's going to open for you and sit, that's a 10, 15 minute appointment max on the schedule. And it's going to take you 5 minutes while they're there. One thing I did not think about that does come in handy is you now have your model inventory digital. So if you were doing a lot of traditional ortho, phase 1, phase 2, whatever, and you had a lot of stone models in the office, those plasters, you can just scan those now, put the patient's name in the chart with their information, and now you have that legal record, and you don't have to hold on to those stones, which in a lot of offices, especially our older offices, those can stack up. So say you purchase an office that somebody did a lot of ortho, and they have those in inventory because they have to kind of keep the records. Now you can get rid of them, but they're still in the cloud, so you're saved. And then just the faster impression. That was my first thing I wanted, was a quicker, easier impression and delivery. So you're going to get quicker and better kind of patient interactions there. Long term, like things that you can do with it outside of your normal appliances that you traditionally do, you can kind of delve into those newer procedures. I had taken all the Invisalign courses and new aligners, prior to kind of getting in my office. I never really did them because I didn't want to take full perfect PVS impressions all the time, because the ones I did, I'd have some back and forth with the lab, and I wasn't going to pay for an iTero, and I didn't want to spend the $20,000-$30,000 on a scanner when I knew the ROI on that was going to take a lot more time to recoup. But now we do aligners in the office. We do a lot more mouth guards. We do a lot more kind of little cosmetic work that I can do with it on some pegolateral cases and stuff, which makes things really smooth. And then I like the kind of options you have with aligners nowadays. It's not just Invisalign. There's Angel Aligner. I've used OrthoBrain before, and there's a lot of different ones out there. If they take an STL file, you can use them. And almost every aligner company out there is up to par with a lot of Invisalign's tech, and you can get some really good cases out of them. Procedural confidence is up because you just know that when you have that tough kid, you're going to be confident in telling mom, like, yes, I know we have to take the tooth out under sedation, but I'll be able to walk them through a cementation because it's less stimulating, because I don't have to touch the gums. And those kind of things go a long way when you're handling those harder patients. And then marketing wise, this is something we talk about, the technology we implement in the practice. When I got the SOAN, we made sure our patients knew about it, how cool it was. We don't have a numb lip. It's so much easier for the patient. We can have a quicker restorative. And this is, hey, we don't have to take that goopy impression. We can take a little picture with a wand in the kid's mouth. Parents think it's cool. Some of that education there does go a long way, because they'll kind of tell their friend in the neighborhood, and that's what you want. You want it kind of out in the community that you're utilizing this stuff. And then we highlight it on social media and our website so people know. And then your referring dentists, they also know, like, hey, you're doing, the best you can for your kids, getting really reliable images and fits, and it just helps your overall community awareness. So when it comes to purchasing, like, what does it cost? The nuts and bolts. These all do come with 3-year warranties. You can get the 200E, AlliStar 200E, which is the wireless version that I have. You can get it with or without the laptop, and those are your cost differences there. The corded version, again, comes with or without the laptop. It does come with 4 large tips. We have 2 of the small tips. We do like an impression or 2 a day. We're a lower risk population, so we're not chucking a lot of teeth at an early age. We usually get them early and keep them from needing those things done. But you can order as many as you need. They're autoclavable. It's like with your intraoral mirrors. If you're taking intraoral photos, if you kind of wrap the tip where the mirror is with some gauze before you put it in your autoclave bag, you're good to go. It's going to really lengthen the time in which those last. Aaron, correct me if I'm wrong. Is it 80 autoclaves is what it says?
50 or 80, something like that.
Something like that. We've definitely more than 80, and they're still working just
no
fine.
one's counting. They last for a while.
Yeah.
As long as you put the gauze over the mirror, they last for a while.
That's the trick. And, the team with Voxel, who is the tech behind the AlliStar, and then New Smile themselves, you're going to get training and support on the product, so you guys will feel comfortable using it, even if you need a little help along the way. I'll let Aaron talk about this a little bit.
So this is coming up. If y'all have not heard yet, it's our hands-on training day in Houston. It's a 1-day all hands-on training day. So we'll go over the SOAN Sleeper One and the scanner. And the instructors for that are going to be Patrick Ruck, Paul Bond, and Josh Solomon. All three of them will be there in one day, which is those are some good names for one day. And it's at the Bush Intercontinental Airport Marriott. So literally you can fly in, stay for the day, and fly back out if you want. There's some cool things to do in Houston, and the weather's great right now. So if you want to stay for the weekend, great. But you can get it done in one day. And 6 CE hours just hanging out, and really we're gonna like have sew-ins, sleeper ones. You can touch them, you can inject on each other. We're like, it's all hands on. So I highly recommend it if you're, interested in any of those devices. If you already have any of those devices, still come. They'll perfect your technique. Lots of tips and tricks, and they're all great teachers. So I highly recommend coming. Scan that QR code for the registration link. If you don't scan it right now, just reach out to us and we can get you signed up.
Yeah, no, that'd be great if you're looking at any of this tech, doing hands-on with those guys. They're very, very knowledgeable with everything pediatric dentistry, but with their technology as well. So if you want to take that little trip or are in the area, I would definitely jump in on that. This is also a little QR you can scan to get a demo with Jordan, and you can try the units yourself before you buy it. So if you're like, hey, I want to try this out, get it in my hands, get it in my team's hands before I try it, they'll shoot you one out, and then they can kind of from afar let you know how it works and let you just play with it. This is just a quote from the doctor, and then she's saying, give you a heads up. We received the demo scanner and the lab talk back, and then the doc's like, thank for all your help and patience. The demo was definitely what made the sale. The team acclimated so quickly that they didn't want to go without it. So it's like, once your team plays with it, it is something that makes everybody's life easier and the flow of the office easier. But this was just, doctor testimony on it. This is who you reach out to if you have any direct questions on the scanner, any of the new Smile products, or just any questions overall. You can get with Jordan, Aaron, or Isabella. All good resources, all open books, and I'll leave this info there for just a second. And then next page will be my info, and it's just my personal email. If you email me, I'll get back to you. I'm an open book with all the stuff that I use, and the ability to get to me is really easy. If you email me, I'll see it within a day or two and get back to you. This is my email, and then this is Neolab's contact info. So if you want to learn more about like their product, what you can do with them, if you can integrate what you use in your office with what they offer as a lab, reach out to them as well. They're really, really helpful, very easy to work with. The kind of customer service is really good. When we need to get in touch with somebody, it's automatic, and getting lab, turnaround done, even if there's a little glitch in something, has been really smooth with them. And again, this is my personal email.
Just got a shout out, easy and simple, great lecture, New Smile team, and Dr. Lynn.
Thank you.
And then what lab does the doctor use? Neolab. Yeah. So, but like Dr. Lynn said, you can use any lab you want, but Neolab is great, and we don't get any kickbacks for saying that. That's just, they really are a great lab. Olivia, who works with Neolab, she's at all the trade shows. So if you've ever seen a Neolab, at a vendor booth, they're just really great. They do get back to you super fast. And we've had them on webinars before, and the owner is fantastic and always willing to help out. Let's see. Casey, when you do 3D printed appliances, do you have any issue with them interfering with occlusion on cementation?
So yeah, I was just reading that. Thanks for the question. No, I don't. And a lot of times if I'm making I'm usually utilizing that for space maintainers. So they're on, mixed dentition kids. There's still a lot of growth and development going on. Go through the normal post-op. Hey, this is going to feel different for a couple of days. It'll take your time for your tongue to adjust. We're going to kind of take it easy on food for 2 days, like nothing real sticky, nothing really hard, and never have had a complaint. And I do not see any kind of opening cleaning bite with it. It is very, very thin, the 3D printed aluminum, and not an issue that I've had with, the many, many, many appliances I've done with it. But that is a good question. I think if you're in a more static, full grown, older teen individual, that cuspal coverage could have an effect, obviously, on some super eruption or proprioceptive differences in patients not adjusting to it super quick. But my patient population is a lot younger, and we're still in that kind of fluid growth and development stage. So I've never really had a big issue with it.
And the second part of that question is, do you need to scan the opposing arch to help with the lab design?
If I think that I'm going to have any interaction with the upper arch, or if I know I'm doing something that does need a true, occlusion and bite registration, absolutely we'll get the upper. But if it's just a Nance or a lower lingual, we just get the arch that's needed, and that's it.
Okay. With 3D bands, are they opening the bite?
Yeah, again, sorry. Similar question, same concept, but no, not in the patient population that I'm utilizing it for.
180 for large and 60 for small. I think that's talking about how many autoclaves we can get. So 180 autoclaves for the large tips
okay.
and 60 for the small tips, I think is what
I was thrown off on the context there for a second.
Yeah, I was too, but I think that's what it was. And then how much is the price for LHA or Nance from NeoLab?
Honestly, off the top of my head, I do not know. My lab bill every month is such a small percentage of my overhead. I've never had an issue with it because I keep it at a very single percent, side of things. I do know it was a little more for the 3D printed one as opposed to what I would get for my old traditional lab. But the kind of ease and shipping and kind of actual fit was the cost difference for me, being more productive during those appointments. And it's negligible when I looked at that from a true like kind of cost benefit ratio side of things. NeoLab does have a full price list. And I know just like every business, they've modified it, as they've gone through the years. So I've looked at it, a few years ago, never had an issue with my lab bill every month. Everything is where it's supposed to be. But I'd say if you reach out to that NeoLab contact, they'll get you that right away.
Yeah. So I was going to say, just reach out to them. They will get that to you. One thing I wanted to mention that I always just think is really cool is the sports mouth guards. It's like a super fast and like easy moneymaker. I think, have you done it, Dr. Lynn, where you do like a fundraiser or you just like say, let's bring the whole team in and
this was scanned? It was not my idea. It was, I think Jordan or you brought this up that you talked to somebody that did it. We're setting one up for like the next big sports season. But the goal is like, hey, you have a patient that's on a local football team, lacrosse team, hockey team, somebody that needs mouth guards. And you're like, hey, we're going to run a team night. Everybody comes in and we'll do like a team scan and let them come in and kind of see the tech and just do like an hour of what you got to do for the scans and give the parent option. If you're super philanthropic and you want to be one of those, I'm going to pay for everything, free mouth guards for the team. I was planning on doing, hey, you can get it at cost. If you want it, it's yours. This is what it looks like. And you can come get a scan. It's going to not only be like a community building event, but it'll be, a patient marketing event. Like parents that have never stepped foot in your office are now in your office. They get a feel for what your office is. They can interact with your team. That in itself, from a marketing standpoint, for me was huge. So we are planning that. I can't give full credit because I don't remember who I heard it from, but
I don't remember who I heard it from, but I think I brought it up in one of the webinars because I just thought, wow, that's such a great idea. Yeah. Hey, I just had another idea to add on. You could download the team fight song on the, for your song when you're scanning.
So as they're scanning, yes, that's actually your marketing genius, Erin.
I know. It's my next step is marketing. No. But yeah, so with the songs though, it is really fun to have the Mario theme song, or you can do a holiday song, based on what holiday it is. Like it just makes it a little bit more fun. And, the kids, if the more fun they're having at your office, the less kicking and screaming you're going to have. And the more the parents are going to bring them in. So definitely all adds up. Any other questions? I do want to say also that like I am not tech savvy. Um, and like Jordan has to connect my AirPods to my computer half the time for meetings, but I picked this up in like 10 minutes. I went to Vauxhall for a training just so I could learn to sell it. And I think first arch took me 5 minutes. The second arch, after just a quick coaching, took me a minute and a half. So it's really easy, like for real. It really is. So yeah, if I can do it, y'all all can do it. I promise. Any other questions? Ask away. Now's your time. After today, you can't ask any questions from us anymore. So no, we are always here. Dr. Lynn obviously just gave you all his info. You have all of our information. If you want to set up a demo, let us know. Just reach out. If you want to know about any of the other things that Dr. Lynn mentioned, like the SOAN Sleeper One space maintainers, we're here for that too. So whatever y'all want to learn about, we are here for you guys.
And don't forget to do your survey.
Do the survey, send it back, get your CEs. Also check your junk folder because, things go there sometimes. So make sure that it didn't go there, especially if you blocked NewSmile emails. Open those back up so you can get your CE hours. And then next week we have another webinar over bioceramics with Dr. Ruck, if you want to join that with NewSmile. And then the following week we have another webinar over the SOAN and Sleeper One, if you want to learn about that. So NewSmile is always out here educating you guys, letting you know about our newest stuff. I will say too, I have 4 kids, 2 with special needs, and I would not take my kids to a doctor that was using alginate anymore. Like, it's not going to be around much longer. It's all going digital, just like everything else. So, it's time to adopt it, as no one's going to want alginate in their mouth pretty soon.